Here are some common breastfeeding latching problems and tips on how to address them. Number 1. Shallow latch. The baby only latches onto the nipple instead of the entire areola. This can cause nipple pain, cracks, and ineffective milk transfer. Solution: ensure the baby's mouth is wide open before latching. Aim the nipple towards the roof of the baby's mouth. Gently break the latch with your finger and reposition if needed. Use the C-hold to support your breast and guide it into the baby's mouth. Number 2. Baby falls asleep while nursing. The baby becomes too relaxed, leading to a weak latch and inadequate milk intake. Solution: stimulate the baby by gently tickling their feet, stroking their cheek, or using a cool, damp cloth on their forehead. Switch breasts frequently to keep the baby engaged. Ensure the baby is properly positioned and comfortable. Number 3. Nipple pain or cracking. Poor latch or friction can cause sore, cracked nipples. Solution: check the latch and adjust to ensure the baby has a deep latch. Use hydrogel pads for comfort between feeds. Limit pacifier use if it interferes with latching. Number 4. Baby refuses to latch. The baby is frustrated, overstimulated, or has difficulty finding the breast. Solution: try skin-to-skin contact to encourage natural feeding instincts. Offer the breast when the baby is calm and not overly hungry. Express some milk manually to stimulate flow and entice the baby. Experiment with different nursing positions, e.g., cross-cradle, football hold. Number 5. Overactive letdown. A fast milk flow can overwhelm the baby, causing them to pull away or latch poorly. Solution: express some milk before feeding to slow the flow. Use a laid-back position to help the baby manage milk flow. Burp the baby often to release swallowed air. Number 6. Inverted or flat nipples. The baby may struggle to latch onto nipples that don't protrude. Solution: use a nipple shield temporarily to help the baby latch. Stimulate the nipple manually or with a breast pump before feeding. Number 7. Engorged breasts. Swollen breasts can make it difficult for the baby to latch effectively. Solution: hand express or pump a small amount of milk to soften the areola. Apply a warm compress before nursing to ease swelling. Breastfeed frequently to prevent further engorgement. Number 8. Tongue tie or lip tie. These conditions can limit the baby's ability to latch deeply. Solution: use positions that allow the baby to compensate for limited movement. Number 9. Breastfeeding with a small mouth. Newborns with small mouths may struggle with a deep latch. Solution: use the nipple flip technique, flipping the nipple and areola upward into the baby's mouth. Number 10. Discomfort in feeding position. Poor positioning can result in a weak latch and maternal discomfort. Solution: ensure the baby's body is fully turned towards you, tummy to tummy. Use nursing pillows to support the baby and reduce strain on your arms. Thank you so much for watching. If you found this video helpful, give it a thumbs up, share it with other moms who might need it, and don't forget to subscribe.